Okay. Hi, everyone. Welcome to today's What's New in Addiction social work lecture. I'm Zan Rothenberg, one of the program co-directors. I'd like to acknowledge that I'm calling in today from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm very pleased to introduce Julie Wade, who will be presenting on considerations for substance use interventions for older adults. Julie's been working in healthcare for over 20 years. She started as a recreational therapist and received her bachelor's degree from the University of Calgary. She completed her master's degree at the University of Northern British Columbia in social work, focusing on older adults and psychiatry. Julie strives to advocate to enhance options for groups who face adversity. She currently holds a leadership position with Kamloops Mental Health and Substance Use and is a BCCSU fellow. I'll ask that everybody please hold your questions until the end, unless you'd like to put them in the chat box throughout. You'll have an opportunity to unmute yourselves. And with that, Julie, I'll turn it over to you.
Thank you, Zan. And I want to thank everyone for joining today. And I will get started because I know we are on a short time frame. So welcome to my lecture. As Zan introduced, we'll be talking about considerations for substance use interventions for older adults. I am presenting today from the Interior Health region, specifically Kamloops. And so I wanted to take this opportunity to recognize and acknowledge that we are collectively gathered on the traditional and ancestral and unceded territories of the 7 interior region First Nations, where we live, learn, collaborate, and work together. This region is also home to 15 chartered Métis communities, and it is with humility that we continue to strengthen our relationships with First Nations, Métis, and Inuit peoples across the interior. I respectfully acknowledge that I reside, and like I said, I'm presenting to you from the Kamloops to Secwépemc territory, which is situated within the unceded ancestral lands of the Secwépemc Nation. I also really wanted to highlight and give my respects to the Nisga'a band and peoples, as my uncle belonged to this band, and he passed away peacefully about a month ago. It is really important to my family and I to honor more than the land that we reside on, but our family's history and involvement with the historical colonization, in particular the era of the 60s scoop. My family has struggled with their role in this for decades. And over the last 3 decades in particular, my family has dedicated themselves to change through understanding, education, and healing, not only with each other, but with my uncle and his family prior to his passing. Our family will continue to strive for change within and heal in this area, never forgetting the past by ensuring that the atrocities do not continue. I want to highlight here that I do not have any conflicts of interest with this review or area of interest, nor have I received any funds related to this project. However, I do want to acknowledge and thank Interior Health for sponsoring my fellowship with the BC Centre on Substance Use and for all their ongoing support. Throughout this presentation, the learning objectives are listed here. 1 being an evidence-based literature review on interventions with older adults who use substances. 2, a review of the evidence-based literature and for considerations when working with older adults who use substances. And then I will go into a bit of a synopsis of current models of care most effective when working with older adults who use substances. Just a real brief outline for my presentation. I'll give a little bit of a background into the topic and area of interest. We'll be reviewing the literature, as I said, particularly in the areas of assessment, intervention, and models of care, throughout highlighting considerations when working with this population group. I'll be moving into the impacts and implications for social work practice, along with highlighting gaps in research and practice guidelines, and closing with a question and answer period. Moving along to background. The older adult population has been a focal point of during my career, with further education and professional developments in the areas of dementia care, continued community care, and systems navigation, and now with a focus on substance use interventions and outcomes. I have a few key cases that I do hold dear to my heart and hold as the drive for this work and the continued improvement in systems. I do have a couple of stats here. Wanted to highlight that in Canada, the number of older adults has increased from 2.7 million in 1986 to 4.8 million in 2010. It's projected by 2036 that approximately 25% of Canada's population will be 65 years or older. I also want to highlight that globally, the most common substances that are used are alcohol, cannabis, and opiates. And in the past 26 years, alcohol use disorder has increased by 44%. Cannabis use disorder has increased by 26%, and opiate use disorder has increased by 47%. Together with these two demographics and health trends, and the intersect to create a growing public health problem, high-risk substance use, including substance use among older adults. Interestingly here, historical trends perpetuate the misconception that older adults living today do not use substances, yet evidence suggests that current substance use among older adults is substantial and is currently on the rise. I really would like to draw your attention to some of these more daunting numbers and the statistical information pertaining to older adult population and substance use. And according to the BC Coroner Service report, June of 2024, the total number of unregulated drug deaths in 2024 to date currently sits at 1,158. And of this total, ages 50 to 59, it sits at 228, which is roughly about 20%. And 60 plus age range is about 180 deaths, which is about 16%. What I do find profound is the number of unregulated deaths for the ages 60 plus, which really leads to the question, what is being missed? Truly, diagnostic and screening and assessment and treatment are often missed, underreported, or impacted by clinical bias within this population group. Before I get into the full literature review, I really wanted to highlight and acknowledge that this discussion topic is very large and a topic which I am aware is challenging to cover all aspects within this time that we have today. So I really wanted to make sure that everyone knows that I am steering this presentation towards the assessment, interventions, and models of care. Within my literature review, I completed 4 separate searches yielding 50 plus articles, all with peer reviewed and within the gray literature available. The following search topics included substance use amongst older adults, use and adults over 55, substance use and homelessness, older adults and considerations for interventions for substance use, street entrenched older adult populations, no fixed address adults using substances, social work and clinical social work framework, models of care and best approaches to working with older adults and substance use, considerations when working with this population. And so now what I would like to do is move into the emerging themes from the literature review and highlight the evidence-based assessment, interventions, and considerations. Here you'll see from the Journal of Psychosocial Nursing in 2023, the authors explore substance use over the ages of 60 in this article. The review takes into consideration the use of substance use disorder screening, assessment, and interventions for older adults, and the factors related to regular screening and the use of assessment tools with a focus on biological factors related to neurocognitive disorders, depression, anxiety, and metabolic disorders. They also draw attention to the need to consider risk factors linked to chronic pain, mental health issues, psychosocial stress factors such as grief and loss and loneliness, along with the impactful life transitions such as retirement, change in living area, or arrangements, or if any. Again, within this article, the authors highlight the need to review harm reduction and education and provide naloxone training with this population group as a means to reduce overdose deaths, but also infectious disease. This is often overlooked. As far as treatment interventions reviewed in this article, they suggest realistic treatment goals of reduction versus abstinence and partnering with the older adult to ensure autonomy. Education and motivational interviewing are highlighted as interventions to support the initial steps of harm reduction and engagement towards treatment if desired. Along with close monitoring, it's highlighted that annual screening associated with comorbidities and consequences related to the substance use and other health conditions is recommended. The article concludes with recommendations for existing screening, assessment, and interventions to tailor their approach, including long-term supports for this population group and a focus towards the physiological, mental, and emotional changes within older adults. Within this article, Substance Use Disorders in Geriatric Population, a review and synthesis of the literature of a growing problem in a growing population within the Journal of Current Treatment Options in Psych 2023, the authors take a look at the prevalence of substance use among the older adult population. The authors conducted a literature review with three main criteria for inclusion: a published English text focused on older adults, with the focus on older adults rather, and the identified substance use or misuse within the literature. Key points from this article break down alcohol use disorder, cannabis use disorder, stimulant use disorder, with a focus on cocaine as a drug of choice, opiate use disorder, and benzodiazepines. As it looks at the epidemiology, special considerations for the older adults in treatment of said disorders, and looking at the different levels of healthcare screening, and referring to specialists in geriatric medicine, psychiatry, and addictions med. From this literature review, the benefits of early detection, referrals to treatment, and program are identified. Also discussed within this article are areas for improvement, as time and age-specific tools are a big focus. It is of note, in most healthcare settings, there is a limited amount of time to spend with client care, and it is challenging to have a direct conversation related to substance use disorder or pattern of use, or the stigma and shame that one may be experiencing. Also referenced is the need to explore more age-specific screening tools. As indicated, some screening tools have been modified, but more with a focus. This article actually really specifies it needs more of a focus on the biological and social factors related to older adults, along with changing in social norms, symptom tolerance, and withdrawal, as it may manifest in them. This article is one of few, which I found, that touches on the racial and socioeconomical disparities with older adult population, discussing the rates of assessment completion could differ, satisfaction of the interaction, whether telehealth versus in person, and geographical location. Of note, this article only references the United States of America and doesn't use any Canadian demographic information, which could actually yield some different results and discussion points. Finally, the authors reference the need for future research in the following areas: biological and social factors, which make it difficult to recognize substance use disorder in older adults, with a focus on screening, assessment, interventions being tailored to this population group. Here I wanted to draw attention to some of the work that's being done in Canada. I also want to highlight that it was found through my Gray literature search. So this is a website that I'm drawing attention to here. It's for the Coalition for Seniors Mental Health website. The organization received a grant back in 2017 from the Substance Use and Addictions Program of Health Canada to create a set of 4 guidelines on prevention, assessment, and management of substance use disorders for older adults. All the information gathered through their literature review was done in collaborative working groups, roundtable, and clinical expertise as a part of their approach. And they all examined the literature using a GRADE approach, which stands for Grading of Recommendations, Assessments, Development, and Evaluation. A full methodology and description of the makeup of the working groups and clinical collaboration can be found in a separate document on this website if you're interested. Over the next 4 slides, I want to draw attention to each of the recommendations within the guidelines on this website. They're specific to working with older adults, and they are specifically in the areas of alcohol, benzodiazepine, cannabis, and opiate use disorders. Within each of these tabs, there's information for both clinicians and family. And according to the literature review that I conducted and much of what's in the literature thus far, alcohol still remains one of the predominant substance used amongst this population. So here's our first guideline that I wanted to draw attention to, the Canadian Guidelines for Alcohol Use for Older Adults, 2019. Within this guideline, there's a range of information pertaining to 22 recommendations focused on prevention, screening, assessment, and treatment of alcohol use disorder with the older adult population. Within this document, there's a large amount of information that pertains to the impacts of alcohol use within this population group. Highlighted is the frequency of screening and assessments for older adults, with a focus on expanding the settings for screening to take place, and not only to happen within a primary care model, but to focus more from a holistic collaborative approach to obtain a comprehensive assessment. As far as treatment recommendations, this guide provides a full scope of options and recommendations, from harm reduction, withdrawal recommendations, and psychosocial interventions. I wanted to draw attention to the table here that is a breakdown of some of the screening tools that are currently used with regards to alcohol use disorder. You can see here that there is 3 specific tools that have been identified for the use with the older adult population. It's the Shortened Michigan Alcoholism Test, the Comorbidity Alcohol Risk Evaluation Tool, and the Seniors Alcohol Misuse Indicator. All 3 actually are set to administer within a 2 to 5 time frame, 2 to 5 minute time frame, and have listed here in the table with pros and cons to the implementation. I really also wanted to draw attention to some of the other commonly used screening tools for alcohol use disorder, as they've also highlighted pros and cons in this table for the use with older adults. Moving along, you can see here the title remains much the same, Canadian Guidelines, but this one here is on benzodiazepine receptor antagonist use disorder. Within this document, there are 23 recommendations with 4 main categories to consider and reduce harm within the older adult population. Minimizing and preventing is 1, recognizing and assessing is 2, management of the benzodiazepine receptor antagonist use disorder, along with the last, which is the ethical challenges with prescribing. Here you can see that they do have printable guidelines. This is a clinical tool and is a very solid resource as far as the literature goes. And it's really a use to support your patients or your clients. And it is a resource for older adults and their partners as well. So the same exists for cannabis use disorder among older adults. This guideline is available for more in-depth breakdown in the areas similar to the previous guidelines. It also outlines a number of recommendations related to cannabis use in older adults, many of which are focused on clinicians' understanding of the cannabis use and the cannabis use disorder, cannabis and its ability to screen and assess and diagnose accordingly. I really wanted to draw attention to this table within the guidelines. It is a guide, but what's really neat about this particular table is it draws attention to the biological area and symptom, which often may contribute to a mixed presentation during screening and assessment. You can see it highlights the problem areas being the central nervous system, psychiatrically, respiratory, cardiovascular, and gastrointestinal. And I won't go through the entire table, but you can really see that there are a number of different symptoms that actually manifest, pardon me, for older adults that could be mixed for something else happening for them as well. And it gets missed that maybe in fact they are using cannabis. And the last guide that we'll go through during this presentation is the Canadian guidelines on opiate use disorder. Within this, there is a breakdown of 9 recommendations with the focus again on prevention, avoiding use, or when and how to intervene with opiate use disorder. Included is further recommendations related to pharmacological treatment and psychosocial interventions, and areas for future research. In this particular guideline, there is a breakdown of screening, interventions, and guidelines, along with areas for future research. It's of note that this guideline, or it's of note within this guideline, that there is a growing number of older adults using substances and opiates in particular, and that this guideline has been created for practical use and as a clinical aid, along with the intent to be an educational tool. From these guidelines, I really wanted to highlight the DSM-5 criteria, just for the notion of the considerations for older adults that are listed here. So for each of the 11 criteria that you can see, there are considerations that are broken down for reference during an assessment for alcohol use disorder within the older adult population. And it really focuses on the biological considerations under each of the criteria. It provides assessors with a comparison, younger versus older, and how symptoms may present, and also how they may present differently. I think what this does for myself in my own practice, and what I'm hoping folks will pull, is that this highlights the need for proper screening and assessment and diagnosis in order to improve intervention pathways for older adults who use substances. So moving into some of the moving back to the peer-reviewed literature, within the American Journal of Public Health, the authors discuss here screening, brief intervention, and referral to treatment for older adults with substance use in 2015. I just wanted to point out here that the use of the term misuse in this article is one that I consider to be stigmatizing, and I'm only using it as reference point because it's what the authors have used. Within this article, the study, they discussed the study suggested that non-healthcare settings be given the opportunity to actually have a role with the screening and brief intervention and referral to treatment process. They also talk about a pilot that was done across 18 Florida counties, and it involved 3,497 screenings and 10% receiving brief intervention. And the aims were to outline the screening methods, substance misuse patterns, and outcomes for and the outcome differences across 4 provider types, not just healthcare. So one being healthcare, of course, other being aging services, the other being mental health, and the last being substance abuse treatment. Key aspects from this pilot included staff training, risk assessment tools, motivational interviewing, brief intervention, and treatment referrals, and data entry. Some of the limitations within this article are definitely with age and geographical location, service agencies providing the screening in the study, and with follow-ups. They tended to be more swayed. So essentially the higher numbers that were conducted here with the research was with alcohol use disorder. And it was predominantly because I'm going to say it was conducted in Florida, and anyone who knows the Florida political kind of landscape, people don't usually disclose any illegal substances. The authors discuss how team members, such as a psychologist, social worker, nurse, and social service providers, could be implementing the brief intervention to help older adults. And truly, there is an acknowledged area for future research here within this article. And they talk about the need for universal screenings to be embedded into any intake assessment within a healthcare setting, and for all patients with substance use disorder or suspected substance use disorders to have the opportunity really to have this so we can do a better job of screening. So I wanted to draw some attention to here, which is like this document through SASHMA. It's titled Treatment Improvements Protocols, and it's developed by the Substance Abuse and Mental Health Services Administration in the United States. It's a department that essentially, a department within the United States that dictates quite a bit when it comes to substance abuse and mental health services. Here, they've highlighted that it is a state-of-the-art treatment of practice. It is built from experts in the field of both clinical research, program managers, policymakers, and government and non-government parties. It is an agency, like I said, within the U.S. Department of Health and Human Services that is the lead in public health. Within this report, it does provide a lot of information. This particular protocol is also referenced quite a bit in the literature, both in the peer-reviewed as well as in the gray literature that I've found. And I really wanted to draw some attention to it for its benefits. It does provide considerations and recommendations for substance use disorders for each different substance use disorder, and it breaks it down into sections for individuals to have a better understanding of the issues, principles of care, identifying, screening, and assessing of each, and the treatment for said substance use disorder. Factors associated with the substance use disorder and cognitive impairments is highlighted within, and the importance for social supports and wellness strategies for the individuals and their families. The resources within this protocol lean towards its application within the United States, but is a very good starting point and a good point of reference. I do think that this document has a role for informing older adult programming, and believe it does also have a role for future Canadian research and policy. I wanted to highlight a couple of different exhibits within. Here you can see that this one here is the characteristics of age-sensitive alcohol treatment for older adults. And this one, so the protocol has these throughout, but here I really appreciated and wanted to draw some attention to the approaches around supportive and non-confrontational approach, flexible programming, sensitive to gender differences, sensitive to the client's level of physical and cognitive function, holistic approach, and focused on helping older adults develop and improve coping and social skills. The authors also highlight older adults are successful in reaching treatment goals of abstinence or risk reduction. and having nearly the same or better outcomes than younger adults. And they also are more likely to complete treatment than younger adults. And they also benefit greatly from age-specific treatment. Another exhibit I wanted to highlight here is the important characteristics of age-specific treatment for older adults that is recommended within this article, or sorry, within this protocol. Accessibility and program specific are the two major focuses. And what I actually think is quite interesting is that they break it down into aspects like using larger font, offering adaptations for individuals with cognitive, visual, and hearing impairments, transportation, in-home services, offering sliding scale for self-pay clients, and also looking at, when needed, supplying resource linkages or referrals to food, clothing, shelter, other older adult focused social services, employment services, finances and housing. They also, again, talk about this non-confrontational manner. They talk about focusing and building on self-esteem and coping skills, and just different modes of tailor-specific programming. Last image I want to share with you from this protocol is really a wellness, it's a wellness wheel, essentially. That's why, yeah, it's a wellness wheel. And within this, it actually talks quite a bit about each of the areas of an individual's life that needs to be encompassed. It really supports the holistic care. And it really breaks down the 8 dimensions of wellness according to SASHMA. You can see here from the wheel, there's an emotional, an environmental, financial, an intellectual, occupational, physical, social, and spiritual component. And all levels of management, clinicians, and individuals have a place or a role within this aspect when working with older adults. Drawing attention here to the author's take of this article, substance use, or sorry, the authors of substance use is a critical health and mental health issue of older adults. The literature indicates a rise in rates of substance use disorder amongst older adults, encompassing not just alcohol, but also prescription medications, opiates, and cannabis. Following the SAMHSA and the Canadian Coalition of Seniors Mental Health Guidelines, it emphasizes the need for routine screening for substance use disorder and interventions, treating these like any other chronic disease. It is crucial due to the age-related biological conditions that may be affected by the substance use. Within this article, there's a call for an increase in education, detection, and intervention across disciplines to address the complex vulnerabilities and comorbidities in older adults with substance use disorder. It also suggests a comprehensive roadmap to evaluate and improve screening, addressing barriers such as stigma and considering cultural factors. The review supports updating existing guidelines and practices for older adults using substances. I found a relevant document from the Canadian Centre on Substance Use and Addiction that aligns with these recommendations as well. Drawing your attention to this here, it is of course grey literature, and want to review its importance to the Canadian landscape for health and service translation for older adults. This document was released in 2018 and was compiled to provide a broad, high-level overview of the important health issues, drawing on neuroscience and the understanding of behavioral and social contexts that shape older adults and substance use. It aims to give decision makers, policymakers, nurses, geriatricians, researchers, and others working with older adults the opportunity to consider the evidence as they develop and employ more effective prevention and intervention programs to address substance use among older adults. This document has sections with topics such as substance use and successful aging, epidemiology of psychoactive substance use among older adults, the aging brain and substance use, consequences of alcohol and drug use in older adults, and considerations for co-occurring health conditions, detection, screening, and assessment, and substance use treatment for older adults. This is a good resource and a really good starting point. After reviewing this literature, it has noted much of the information thus far and is supported. Their recommendations and approaches are supported within the peer review literature so far as well. I do want to draw attention to the section 7 of this document. So section 7 is the substance use treatment for older adults section, which reviews the best interventions for older adults who are using substances. It also references the TIP protocol by Sashma, and it also has a really good focal point for our Canadian healthcare and landscape that we currently work within. The review examines various levels of care for older adults with substance use disorders, and truly the focal points of this chapter, they focus on early screening and assessments, identifying substance use disorder in older adults being very crucial. They actually talk about each of the treatment options and how to move forward for all of these listed: alcohol use disorder, opiate use disorder, benzodiazepine use and withdrawal specifically, nicotine dependence, and cannabis use disorder. It talks about the different care types, and included in that is inpatient and outpatient care, highlighting weekly and individual and or group counseling. It also highlights intensive outpatient care, whether that be daily counseling over extended periods, kind of beyond the 8 to 4 Monday to Friday mark. They also review long-term care or residential care. So the idea of a 24-hour supervision and monitoring for this population group. And they also talk about medically managed inpatient care, so supervised medical or psychiatric hospital treatment. The review highlights the use of cognitive behavior therapy and supportive therapy models for the psychotherapeutic and psychosocial support. It emphasized building social supports, self-esteem, and coping mechanisms. The author actually of this chapter advocates for combining cognitive behavioral therapy and supportive therapy models with like a motivational rather than confrontational approach, which is also noted in lots of literature thus far. It also notes that contingency management should not be used in isolation. Case and care management models are discussed with a focus on the holistic approach that includes the biological aspects, stigma, pain management, and more. Additionally, addictions treatment in primary care is also reviewed within this chapter and does focus again on considering the time constraints, functional limitations, and relationship between substance use and risk factors like falls, hypertension, and depression. The author also notes that addiction in older adults is often seen as a last pleasure, leading to a misdiagnosis or an underdiagnosis. Common interventions highlighted in this this chapter, like mentioned before: screening, brief intervention, referral to treatment, motivational interviewing, cognitive behavior therapy, and in various treatment settings. The literature emphasizes the importance of autonomy, choice, and person-centered approach in treating older adults with substance use. It does take into account, again, the biological factors and the need for specialized treatment. Drawing attention to this article here in substance use among older adults, an update on prevalence, etiology, assessment, and intervention. The author continues to support the gray literature along with the previously peer-reviewed literature with this article of, as I just mentioned, prevalence, etiological, or etology, anyways, I'll move on. Assessment and intervention, which continues to support the previous literature as I suggested. But it does highlight some real key aspects. One, research to better understand substance use among older adults, assessment of substances, and the use of validated assessments across our older adult population and cultures. Competent professionals who can work with older adults in these high-risk substance use, and a wider array of treatment options. I think final note of this article, they highlight that fewer older adults attend treatment due to barriers, and treatment services specifically tailored to older adults need to be more accessible, and barriers need to be reduced. I also want to highlight this article as well, a similar author, really highlighting the need for prevention, harm reduction, psychoeducation, and pharmacology interventions, behavioral interventions, and some structural changes and implications to supporting older adults. Moving into this article here, which is the community-based interventions for problematic substance use later in life, systematic review of the evaluated studies and their outcomes. The authors here really focus again on education and harm reduction, routine screening and provision of information about substance use, interventions and their effectiveness, and the implementations of models of integrated medical and psychosocial interventions that are used in a collaborative model. Within this article, there's actually a mapped out model for care along with interventions. And here I wanted to highlight it because it actually shows different levels of patterns and severity. It also shows the level of interventions associated with the pattern and the severity. And then below, you can see it branches into different interventions based on the level of use and severity of the use. Now, this model is not specific to older adults. I do want to highlight that, but I do think it's a really good and useful starting point, as it does give a sense of intervention levels based on the severity, and I think it can actually be one that we can modify and adapt for older adults. You'll see here that there is a term called wet care home, which is defined within this article as individuals who have complex care needs who require 24/7 care, and they actually get the support to utilize their substance of choice within that setting. I'll move along. I do want to draw some attention to some further peer-reviewed articles. Within this, Aging, Multi-Morbidity and Substance Use Disorder, the Growing Cases of Integrated and Principles of Care of Geriatric Care and Harm Reduction, within the International Journal of Drug Policy. Ultimately, within this article, I really want to draw attention to the idea that integrating geriatric care principles with harm reduction to address aging, multi-morbidity, and substance use disorders amongst a growing population. It actually may, in fact, be a new concept to some, But I actually do feel geriatric medicine focuses again on that patient-centered, goal-oriented outcomes and strongly supports the idea of functional status and independence rather than just a disease-specific result. And it could be a positive change as far as the delivery of care with our older adult population. Another article that really focuses again on substance use amongst our older adults living in a residential care facility. This particular article really hones in on the person-centered approach and the value to this when working with older adults who are diagnosed with a substance use disorder, who do live within 24/7 care. It does call for more research in this area, specifically in the environments of long-term care for that 24/7 care approach. And it does suggest interdisciplinary and health authority involvement in that research. This article here supports supporting older adults with health and social care needs, is a case study based out of Ontario. And essentially the lessons learned from this article is that services should be organized based on individuals' need rather than a rigid organizational roles and responsibility. Wanting to draw attention to an article with regards to aging in place, or as this one is, aging in the right place. This is an article that researches the need to actually support individuals to age in a place that is known to them, and actually build within community and relationships. I am going to move this along here. So this is actually a framework that they put together, and it does highlight actually building around individuals with the focus of building environments and housing units to surrounding neighborhoods, bringing on and off-site health and social services and resources. Social integration is highlighted. The notion of stability and affordability is also highlighted, and emotional place attachment is a big piece to this. And of course, the broad overarching political and economic forum. Just wanted to highlight there is a bit of limitation. There is a limitation to this study as it was funded by the Canadian Mortgage and Housing Corp and Social Sciences Humanities Research Council. Here is the final model of care that I will be looking at, as founded here in the Community Informed, Integrated and Coordinated Care through the community level model. They did a literature review and synthesized information and came up with a model of care, which is considered to be a hub. And so what that means is it's leveraging existing spaces and facilities within communities to support community health and improve the continuity and effectiveness of care and delivery. And they have drawn this model up here. So ultimately, you can see that chronic disease management, mental health and addictions, seniors, family and reproductive health are at the center, and those are considered to be the core foundations to this hub model. Other things such as health promotion, psychotherapy, and housing and recreational programming are secondary. So moving along, I really just wanted to take an opportunity to highlight that I know within each of the health authorities in BC, there is a number of different models of care which are applicable to older adults that I have not included in my presentation. And I know that they are integral to the work that we're being done. I do also want to highlight that the interdisciplinary team members within each of these models of care that are being applied to our older adults are absolutely critical when it comes to meeting the needs of our older adults. How does this apply for us here? And what does it mean for our clinical social work practice? I wanted to highlight this research here. It is up and coming, as in is being done here, and they're looking at how do social workers best support older adults. Ultimately, we support them through, or the profession supports them through communication, relationship skills, expertise in crisis, change, conflict, knowledge of law and health related policies, knowledge of local resources, and applicability to the individual's care, strong in advocating and upholding the voice of the individual or the client. And truly, the social work profession is a leader in coordinating multi-service providers for a single individual. Within this article here, Casting Light, which again, it talks a little bit about, again, social work practice and the social work values and influences on teams. And it talks about, it actually did a questionnaire amongst different teams, and there were themes that actually emerged from this research that highlighted the importance of the social work role within our interdisciplinary teams. And some of the themes really that were yielded from this research is that the social work values and influences impact the teams. Social work role is very positive risk management. And they have an importance of relationships and timing, and they're very proactive when it comes to the application of specialized knowledge in both legal and health-related population groups. I really wanted to draw attention to this article, which highlights a few details related to the delivery of psychosocial behavioral interventions within the substance use field. I guess at the end of the day, this article really hones in on the idea that social workers and the best psychosocial interventions for substance use fall within the realms of cognitive behavioral therapy, relapse prevention, contingency management, community reinforcement approach, motivational interviewing and enhancement, 12-step facilitation, and family therapy. The article highlights a future role for education within the social work field, especially with the idea of ongoing and enhancement of substance use disorder education for social workers, as well that it talks about social work researchers being uniquely positioned to strengthen the evidence base when it comes to taking a closer look at the behavioral interventions that are explored in this article. I also wanted to draw, oh, that's not right. Sorry, everybody. Oh my goodness. Oh God. Okay, let's get back on track here. I did want to draw attention to the previous model that I did review before, and just wanted to highlight that behavioral and psychosocial interventions are they are embedded in this model. I think that social work practice and the social work role has a role in substance use intervention, assessment, and treatment. And this article definitely does support that. So in summary, what are the considerations when working with older adults who are using substances? Ultimately, we really need to focus on assessment, intervention, and models of care with a tailored approach. We need age-specific tools. We need to use validated screening tools that are applicable to our older adult population. We need to consider the biological factors and integrate them into screening and our assessment and intervention strategies. We have to consider health factors, whether they're pre-existing or whether they are a part of the makeup that we see. We have to consider chronic pain. We have to look at aging and the quality of life, no matter what. address the time issue, spend the time with individuals. Our approach is key, and the idea that there is stigma associated within this older adult population group and the disclosure of the use of substances. Our intervention strategies, we really do need to balance reduction, maintenance, and harm reduction, and we really need to include the individual in the strategy. And also the treatment guidelines, we need to adhere to guidelines that are tailored specifically for older adults. We really need to take into consideration that there is the work that's being done, and there is an approach that we can utilize for our practice. Now, as far as the social work practice, I mean, the social work role, there is the need to take a lead as far as communication and the relationship skills. Expertise in crisis and conflict are crucial. Family dynamics, our biopsychosocial assessments and involvement of family is imperative, and the family-based interventions. Knowledge of law and health policies, being a champion when it comes to legal and health systems as far as older adults goes. Also understanding your local and provincial resources. Advocating for the client's voice no matter what. And leadership. Taking a strong leadership role on our interdisciplinary teams, and really upholding that part of the role of social work. I do want to highlight our role within the interventions of substance use and older adults, counseling-based treatments, and other behavioral interventions, contingency management, motivational interviewing, cognitive behavioral therapy. These are crucial for the social work role to be skilled and apply to our multidisciplinary teams. Gaps in research and practice guidelines. I mean, essentially, we've highlighted this. There is a gap in age-specific screening and assessment tools. There are a few that have been modified, but I do believe there could be more that's done. We need to update our practice guidelines and our current numbers within the substance use disorder realm and what's being used amongst our older adult population. We need to expand our research focus as far as Indigenous, Métis, and Inuit older adults. We need to look at age-specific research for individuals aged 40 to 60. We also need to look at Canadian policy research and include substance use with older adults. We need treatment options that are specifically tailored for older adults. And I think we could definitely look at an expanded research into the effectiveness of psychosocial interventions. I do note that an extensive investigation into various models for substance use intervention amongst our older adult population is an area of need. And included would be within the realm of social work and clinical social work. We really do need research to define those roles, define the education and the supervision within the substance use field, and also look at our role in the development of family-based interventions within this population group.
Julie, as you move to the next slide, okay, good, you're at acknowledgements. I am going to quickly move to a couple of questions because you only have a couple of minutes left.
Yes.
And you do have a number of questions in the chat. So I just want to first thank you for drawing so much attention to a really important topic. You've done an excellent job of synthesizing the literature. This goes to show you how much information there is to share. And I'm sure that you probably have enough to do a part 2 of this presentation because it's just such a large topic. So thank you for that and bringing such attention to this population and this topic in general. We do have a number of questions in the chat. I don't think we'll be able to get to all of them. I'm going to just say to anybody who's put a question in the chat box that I will make sure that Julie gets them so she can respond to you individually. But we'll get to as many as we can here. So our first question is around treatment centers focused specifically on older adults. You did touch on this at the end, saying that there may be a bit of a gap, but I'm just wondering, do you have a list, or the question is, do you have a list of treatment centers for older adults who use substances in BC?
So currently I do not have a list of treatment centers that are specifically tailored for older adults. I do know that a number of the resources currently in BC do address kind of that older adult population group by doing some cohort style kind of intakes and that type of work. But there is no, like, as far as I'm aware, I do not have a list. I would love to see a list be compiled.
Thank you. Of course, as this often happens in our What's New lectures, we do have a request for a list of your lit review to be sent out. So to the person who put that in the chat, we will work on getting the list out to all people who attended today. And maybe I'll end on this question because we were 1 minute over time. I'm sure people are off to their next meeting or next appointment. But there's a comment that says, thank you for sharing your personal connection to this work. Fabulous lit review. The question is, do you have any suggestions on how to use this literature and resource into practice? And I will just add that, you know, there's an acknowledgement here that there are many interdisciplinary teams who don't necessarily specialize in working with older adults, but have them on their caseload. So this is a question of mine too. What is the next what is the first step for teams to be able to integrate some of what you've shared today?
That's a very good question, and thank you. I think a first step would be to visit some of the current existing guidelines that are available to us, and really, you know, whether it be a specific discipline that wants to take that on. I mean, I know from my own practice framework, I feel that social work is very well positioned to actually be champions in this area and to advocate at different interdisciplinary, multidisciplinary tables as far as the considerations for our older adult population who are using substances. So I would definitely suggest looking at some of those guidelines and some of the resources that I've highlighted as a good first step.
Well, thank you, Julie. There are more questions in the chat, and a lot of thank yous to you for being able to synthesize and share the information that you shared. For those of you who are interested, we do have another What's New in Social Work lecture coming up, so stay tuned for that. Thank you very much.
Thank you, everyone.